Hello everyone, my name is Jane Pickering and I'm Eldercare's Chief Executive. I'm recording this short video to let you know about the new government's emergency direction for residential aged care, as well as our strategies to prevent COVID-19 from entering any of our aged care homes, and Eldercare's plan that we will use in the unlikely event of a positive case at any of our sites. We've put together a comprehensive outbreak management plan. An outbreak is defined as one positive COVID-19 case of either a resident or staff member. Our plan involves immediately transferring any resident who tests positive for COVID-19 to the Royal Adelaide Hospital. SA Health has a plan in place to ensure that a transfer happens quickly. We know from the experience in Victoria that this action is critical for the successful management of an outbreak. Eldercare will then work closely with the Communicable Disease Control Branch of SA Health, who will assign a specialist team to guide us and manage the contact tracing and testing of all residents and staff. We know that good communication during a crisis is essential. We've developed a specific communication plan as part of our response to a positive case. This includes a member of our incident management group making contact with residents and their primary key contact within the first few hours of a positive case being confirmed. If we have an outbreak at any of our sites, we will need to restrict visiting. If you are visiting at the time of a confirmed positive case, then you will be politely requested to leave the site. We will explain why and ensure that you remain connected with your loved one while we manage the situation. We have a surge workforce plan ready to go in the event of an outbreak, and we've done all we can to secure staff to ensure we can provide the best possible care to your loved ones. On the 13th of August, the state government released a new emergency direction for residential care. From the 27th of August, all personal care workers will only be permitted to work at one aged care home. This does not apply to other staff categories, for example, hospitality, nurses, lifestyle, allied health, admin or property staff. Workforce management plans must be in place for how aged care providers will manage the one worker, one site direction. Nurses and carers will be required to wear masks when they are undertaking care and are unable to keep a 1.5 metre distance from residents. This does not mean masks always need to be worn, but only when physical distancing is not possible. Personal care workers and nurses will be required to complete a new infection control education program as specified by the SA Department of Health. Plans must also be approved by the Department of Health for how each provider will manage infection control and physical distancing for communal areas. Providers must also adhere to appropriate management of residents who have been tested for COVID-19. Eldercare is already compliant with many of these directions, so we will be fully compliant by the 27th of August. It does mean that over the next few weeks we may need to be creative about how we continue to provide our high quality care. You may see some new faces providing care and different staff may be undertaking different duties. For example, our hospitality staff may become more involved in serving food or even assisting residents with their meals, or enrolled nurses may become more involved in helping residents with their personal care. We may also have to reorganise some of our activities for residents at each site during the next few weeks as well. This will be short term. Please be understanding and assist our staff to settle into a new routine. We've been required to reorganise our workforce with only 8 working days' notice, so there may be a few teething problems in the first few weeks. We have also implemented a number of strategies to prevent COVID-19 entering our sites. Key staff have undertaken specialised infection control training over and above the e-learning modules offered by the Department of Health. Every staff member is being retrained on how to use and dispose of personal protective equipment or PPE. All staff members are screened prior to commencing each shift, and they make a declaration that they are not presenting a risk to our residents or their co-workers. We have educated our staff, residents and all visitors about the importance of hand hygiene and physical distancing. All visitors are screened prior to entry into any of our homes. We are paying our staff to stay home if they are unwell whilst they wait for COVID test results, even our casual staff. We're paying our staff to self-isolate if they are living with anyone else who is required to self-isolate. We have adequate levels of PPE and have secured an ongoing supply. We'll be using 240,000 masks per month from now on. As you can imagine, this has been a huge task to secure this amount of PPE. I want to thank you for your continued understanding and cooperation with our current visiting conditions at our aged care homes. I know it's difficult to have limited time with your loved one, but the measures we have put in place are protecting the lives of everyone at Eldercare. If you have questions that are specific to your experience at Eldercare, please speak to your site operations manager or call our hotline on 0477 995 542. This hotline is available Monday to Friday from 9:30am to 4pm. Thank you again for your support and for helping us to keep your loved ones and our staff safe and well.